Hello, assalamu alaikum. This is me, Dr. Jahangir, and you are watching me on my YouTube channel. Now, let's practice some CBC, the interpretation of some CBC. If you have gained something, inshallah, you will pick the abnormality over here. Now, in my first video regarding the hematology and the validity of a CBC, if you have watched that video, now you can pick the abnormality, whether these CBCs are valid or not. Coming toward CBC number 1, this one. Now, is this a valid CBC? A valid CBC means, can you comment on the hematocrit and MCV? Now, what was the criteria? Criteria was the ratio of the hemoglobin to hematocrit will be 1:3. Why? I have discussed in my previous lecture. Now, if you see, the hemoglobin is 10.1 and the hematocrit is 32. So 10.1 into 3 give almost about 30. So this CBC is valid and you can comment on MCV. In this CBC you can comment on MCV. So now you can comment on MCV. So this is a normocytic normochromic anemia, and this sample belongs to a patient who is malnourished. Upon peripheral smear, there are both macrocytosis and microcytosis. So in this case, if you are having anemia and the MCV is normal, so always go for the smear to confirm the size of RBC. So over here you can comment on the MCV. Yes, you can comment because the ratio is normal. The next step is go for a peripheral smear, which shows micro and macro both. As the patient was malnourished, there was a loss of appetite, and later on that came out to be the TB. The main cause for the loss of appetite was a TB, tuberculosis. So that can give you both B12 deficiency and iron deficiency. So they were both replaced, and also was started on ATT. Coming toward the next CBC, this is CBC number 2. So is this a valid CBC? Can you comment on the hematocrit and MCV? So again, ratio. What is the ratio of hemoglobin to hematocrit? So the hemoglobin is 13 and 13 into 3 is 39. So this is not valid CBC. I cannot comment on MCV. This is not a valid CBC. Why? Go back to my previous video if you want to know the answer why. Now coming toward third number. Now if you see over here, the hemoglobin is 10 and the hematocrit is 38. What is the ratio? 1:3? No, you cannot comment on MCV. Now if you don't know about the ratio, if you don't know about the ratio 1:3, and you are seeing this CBC and you label it is a valid CBC, and if you look to the MCV, that is 106, you may order further tests such as folic acid, B12 levels, and without knowing the fact that there was error in collection of a sample, not in the patient. So you are ordering further tests without knowing the cause. You must know about this ratio so that will prevent you from ordering further investigation that affect the quality. So you have to look to the ratio, then comment on MCV. Thanks for watching.